Hello, today we'll be bringing you the counterstrain technique of the posterior cervical tender point 2. There are two possibilities for this tender point. One is in the semispinalis capitis muscle as it inserts onto the occipital bone, and the other is on the superior aspect of the spinous process of C2. So the first thing I'm going to do is find the tender point by checking both of these areas on my patient. And I'm on the superior aspect of C2 and I feel a tender point. So I'm going to let my patient know that because I'm going to be supplying a caudad force on his head, that he may become dizzy or may become anxious at any time. So if this happens to you, just let me know and I will immediately stop the technique.
Okay.
So now I'm going to establish a pain scale. So this is a 10 out of 10, okay?
Mm-hmm.
And since this is a passive and indirect technique, I'm just going to ask you to relax and let me do all the work. So for this tender point, I'm going to slightly extend his head and then supply that caudad force through the vertex of the head to loosen up the suboccipital muscles. So now I'm going to recheck the tender point. So how does this feel now?
2.
That is acceptable. We are looking for about a 70% reduction in pain, so anything less than a 3 on this already established scale. So I will hold this position for about 90 seconds or until I feel a therapeutic pulse or a change in the tissue. If this tender point is slightly off the midline, so for example, if the tender point was slightly to the right, I can side bend him away and rotate him away slightly to fine tune the technique. And then I would once again ask him how he feels.
2.
That is once again acceptable. So after the technique is complete, we will return him passively and slowly to his neutral and then reassess. And how do you feel now?
I think a 1.
And that is awesome. Thank you very much.